Hey everybody, welcome to Ask the Anabolic Doc, starring Dr. Thomas O'Connor and brought to you by his websites, anabolicdoc.com and metabolicdoc.com, both of which you can get this book, gotta read this, America on Steroids, A Time to Heal. And now joining us from the cradle of civilization, the cradle of democracy, Athens, Greece, or is it Hartford, Connecticut? Messing with you, Dr. George, if you're still watching.
We had a good time with Dr. T.
Dr. T is a cool guy. I got to get him on more because I feel like I just scratched the surface with that guy.
He's a cool guy, man. Very cool guy. Knows a lot of stuff. Definitely an anabolic doc. He knows what he's doing.
He's a true meathead. I read his book. My wife drove up to Maine while we were moving my son in, so I had a lot of hours to sit there while we're driving and read his book. And he's got random stuff in the end, like top 100 bodybuilders of all time, and
wow,
contest prep drug cycles. Just a lot of medical stuff in the front of the book, and then toward the end, it's more like a meathead kind of sections. So it was cool.
We got to get him out. We got to get him out of Greece, and we got to get him immigrating over here. We need him in this country.
Well, I don't know how Trump's going to feel about that. So no Greeks.
Damn Greeks.
I hear they're just getting their economy back, so maybe he wants to stick around now.
Wow.
They had a rough.
Hey, let's go there, Ron. We go to one of the Greek islands and do a show there.
Well, Mamma Mia. Both Mamma Mia movies take place in a Greek island. It looks like a pretty beautiful place.
Gorgeous.
Mamma Mia reference. We do have some questions from the readers, but there was something we just briefly touched on with Dr. George last week that I really want to get more in depth with you, because this is something we talk about all the time as American bodybuilders that like to partake of the gear now and then, is why can't steroids be legal? Doggone it, it's not fair. Wah, wah, wah. And, we argue tobacco is legal, alcohol is legal, and cosmetic surgery is legal. And I'm finally starting to understand why steroids can't be legal. But before we get into that, I have to ask you the history, because I don't know if you know this, how in-depth you might know, but steroids were available with the prescription up until around the mid-'80s or so. Is that right?
I believe the 1990s is when they made it a controlled drug because of the NCAA. And because, NCAA,
wow.
all 1990s. I was at Syracuse University, and I remember the football players were jacked to the gills. I won't say names. Strong as crap, acne, and I mean, these are great genetics. I want to say a name or two, but I just can't do it. And this is back in the 1990s, like 91, 92.
Suffice to say, some of these guys went on to stellar careers in the NFL that we're talking about?
Tim Green.
Okay.
Tim Green.
Okay. There we go.
So he wrote a book about steroids and his own self, and he played for the Atlanta Falcons. And again, man, these guys, man, these were responders. I remember seeing them out of season, off gear, on gear, and unbelievable. And then in the 1990s, that's when the feds came in and they outlawed anabolic steroids.
So prior to that, I'm just curious, do you know, could a bodybuilder walk into his general practitioner's office, say, hey, doc, I want to run a gram a test a week and a gram a dec a week. Hook me up, and they would do it?
They would do it. Well, first of all, there was classic doctors. I mean, if you look over the country, I've heard of doctors that I actually have their patients now, 20, 30 years later, because now they're my age or they're into their 60s and 70s, and I have all these guys. And some are famous, some are, old Mr. Americas and all these kind of things, and powerlifters back in the day. Yeah. Most of the doctors, though, they gave, just a little cypionate, propionate, enanthate. I think might have Sustanon 250. They just give that 1 to 2 cc's a week kind of deal, and they did give Anadrol. Yeah. They had A-bombs, and they gave Anavar and Dianabol, and they did.
Right. So, but I mean, when you write a prescription now, and I assume it's always been this way, you have to indicate what the prescription's for, don't you?
Well, you don't have to write it on the prescription, but in your notes, in your assessment, in your SOAP note, there's subjective, objective, there's an assessment and plan, and if you have to do a history and physical. So the guys that I prescribe it for they're either on testosterone for years, and it's just kind of continuation therapy, and it's hypogonadism, But most of the guys, they're on they're giving themselves steroids, and at a certain point, they shut themselves down. So that's anabolic steroid induced hypogonadism, right?
Right.
So that's just and this is millions upon millions. I mean, business is very good. I'm not going to be a wise guy. I don't want to be fresh, but guys want to come in for the cold. I saw two today. I mean, just unreal what's going on. I mean, they're coming in and other doctors. Half the guys I see now, they're coming from other physicians that are giving them testosterone, but they just don't. One guy came in today. He's getting 100 milligrams, half a mil, intramuscularly injected every 2 weeks.
Wow.
So he's going through ups and downs. He doesn't feel good. The doctor is an absolute sweetheart who's referred the patient to me, and he's got polycythemia. He's got tonight. A big video's coming out. One of my biggest videos I've ever done in my life is being released tonight about steroids, decadrobolin, equipoise, and polycythemia, red blood cell. So the guy gave him to me because I went to med school with him. He's a sweetheart, and he's referred a couple of people, and he's got a lot more coming. He's a primary care doctor in Florida. He doesn't feel comfortable taking care of men on testosterone because of the cardiac and the polycythemia, and the guy's a great guy he was taking care of, and he's telling the doctor, Doc, we don't take 100 milligrams every 2 weeks because that's just, I feel like crap after a few days, and then a week later my test is like 100. It was like he checked them in the nadir before the injection. 2 weeks later, 132.
Wow. Well, okay, so I guess back to the point I was trying to make was, and I know the doctors you're talking about, because a couple of them were high-profile doctors in the LA area, from what I recall.
Yes.
They worked with a lot of celebrities, some top athletes, but mainly celebrities. And I mean, they were prescribing steroids for guys purely for cosmetic purposes. There was it wasn't testosterone replacement. It wasn't hypogonadism. It's, I'm shooting a movie with my shirt off in 8 weeks, and I want a six-pack, and I want some bigger arms and bigger chest, and they would do it. These doctors would do that for them. So
Lyle Alzado, remember Lyle Alzado? He got steroids from doctors.
I believe, what was that guy, Zaharian, or it was a very famous doctor in LA.
Yeah, that's right.
He had like thousands of patients. I'm sure he didn't see them.
LA, yeah, and they end up going to jail in the end, lost their licenses. It was a witch hunt against them. I mean, this is what happened.
Right. So, okay, so in that era for a long time, and I know even like in the 70s, it was the same thing. It was Arnold even makes a point a lot of times of saying it was legal with the doctor's prescription because he wants people to know he was never breaking the law when he used steroids, because it wasn't illegal back then, and doctors would write them for the bodybuilders.
Yeah, absolutely.
So we're at a place now where there's so much interest in, I don't know, we're baby boomers, the generation after baby boomers, whatever the hell we're called, I don't know. But what are
Generation X? I forgot. Generation X? No, I don't know.
That's after us. I don't know what the hell we are. But there's a lot of guys right now in their late 30s, 40s, into their 50s that they just want to look better. And they're not really, a lot of them, I guess a lot of them aren't deficient in testosterone. They make a normal amount, but a normal amount of testosterone, as we've discussed, that's not enough to give you a really extreme look that a lot of these guys want, Everybody I know that uses steroids, they would never be satisfied with 200 milligrams, 250 milligrams a sip. That would do nothing for us. The look that we're after needs minimum probably cruising doses, probably somewhere around 500 milligrams a week, and then the blasting doses could range to a gram, 2 grams maybe in a lot of cases. So the question is, why can't this be legal for guys that want it, adults? As a prescribed drug, and is it because it's something that's just in the amounts that we would want to use it for? There's just no way any responsible doctor would ever write a prescription for it?
Absolutely. And remember what Dr. T said. He said up on those levels, and he did also phrase and state that there's no studies, or there's just a limitation of studies, certainly with long-term studies. But he said up in those super physiologic levels, it is potentially dangerous. So it's unethical to prescribe something that is potentially dangerous.
Yeah. And it's different from, I'm starting to realize how weak my arguments and how weak the arguments of my fellow meatheads have been all this time. When we talk about cosmetic surgery, we're saying, why is it legal for, are you a South Park fan, Doctor?
What's that?
Are you a fan of
South Park? Yeah, of course, yeah.
Did you see the episode years ago, was making fun of cosmetic surgery, where Kyle, the short Jewish kid, wanted to become a tall black kid? And he had surgery, and he became one, so he could get on the school basketball team. And his dad wanted to become a dolphin, and he had surgery to become a dolphin. And they were just mocking how,
awesome
cosmetic surgery. They'll do anything. Some of them will anyway for money.
Well, look at Michael Jackson. I mean, that poor guy was just brutalized.
Right. So our argument's been, why can somebody do that? And why could somebody? Implants, any kind of implant is legal, anything. So if I wanted to go to some doctor who was willing to put, 60 pounds of silicone implants in me so I could look like Phil Heath, I could have that done. It would look stupid, it would look ridiculous, but it's perfectly legal. And I don't know how ethically responsible something like that would be, but I don't even know how dangerous. Maybe that's really not that dangerous compared to, but that's the argument we use, is you can have that done. But now I'm thinking that's really not as dangerous as somebody using 2 grams of steroids a week for years and years and years, because that's a drug that's working on all these different systems of the body.
It's true.
It's going to have horrible effects on the heart, on the circulatory system, on the kidneys. So maybe we've been going about this all wrong and thinking that it's something that should be legalized.
Rana, it's been about a year together. Coming up, You're coming, and again, I stay out of the politics.
Yeah.
I kind of like to stay directly out of the politics, but the truth is, I mean, I'm responding to men that have already been on the drugs, and that's my niche.
Right.
And some men have legitimate low T, and I take care of them. I love taking care of them. That's game on. That's all I do is men on testosterone mainly, and protecting against the heart attacks and the quality of life. And I love to be the sex doc. I love to really to work with men to really optimize sexual function, because you got to be an internist to do that, because it's mainly all cardiac and blood vessel nitric oxide. But when it gets right down to it, Ron, it's hard to get the head around that you can put in, like you said, 10 pounds of plastic. I think Rich Piana might have also, he had his heart and some of his complicated medical issues were secondary to that ppm. That wasn't synthol he was on. He was on a plastic derivative polymer that was injected, I think, in Brazil or South America somewhere.
I always heard PMAA.
Yeah, PMA, that's right. You're right.
Is it something that women use in their lips, little tiny plastic balls?
Yeah, but that's right. But he put a lot, obviously, all over his body. And I've met Rich. I mean, I was, to say I'm friends with Rich, but, Rich and I had, we had some kind of conversations and throughout time. And I remember seeing Rich and standing next to him and looking at his forearm and looking at that brachioradialis, and I used to look at his body and go, whoever puts this stuff in is an artist. It looks so incredibly good.
Yeah.
I mean, the proportion of that wasn't synthol, and some of that, as people know, and Rich, his traps and his neck and the way Rich was formed. Rich was a big dude, man. That was a lot of that was his muscle.
No, I remember I remember very well. I knew Rich. I wouldn't say, I'm not going to claim I know him. Like, when somebody dies, everyone says, oh, I was his buddy. No, I wasn't.
I know.
I'm not saying I was his buddy. I met him briefly when he was younger. In recent years, I never talked to him at all. But, out in California, he was a Mr. California. I knew him very briefly when I lived in L.A., just knew him in passing from, I think we did some video shoots with him for the American Muscle Show on ESPN. And he was like a 240-pound, 250-pound heavyweight back in the 90s. He just didn't have, if you look at what his arms looked like then and the shoulders, they were probably about half the size of what they eventually became with all the synthetic additions to them. But like you said, he was a big dude, and I got to give it up to whoever did those procedures for him.
So if you do that, and that's cosmetic, and that actually is not legal in the United States, though, that's not, that PMA stuff's not legal here.
Right.
That's not that I don't think it is.
No.
But can you do steroids? And it just comes down, like I saw a young man today, obviously, I won't say more than that. I saw a young man that's been using some steroids, and we really had a great talk, and I showed him his labs, and we talked about, I cleared some questions up for him, very straightforward, and I let him, he shook my hand and he left, and he's going to think about it. And I just, can you let young men, and it's that weird, 18, is it young 18, 20, 25? Can they, you should train until 25, then you can do steroids. I don't want to talk about that, Ron. That's like, you and I both agree, like, you have a young kid. I saw you training your young boy. Doesn't, it's like, how do you give your young child a steroid that you're going to shut his brain down? He could have complications. So it's just goddamn unethical to do. But there's a flip side that so many people do it. I mean, I don't know. I'm kind of lost. I'm lost on the real closure on where it's going to end up.
Well, I don't want to get on a whole other topic here, but I think we have to at least mention it as these life extension clinics or anti-aging clinics, whatever you want to call them. Like I said, I've known people that use these places. A lot of them are based out of the Sunshine State, Florida.
Yeah.
Anything goes in Florida, let me tell you. But
that's why I'm down there. I'm down there trying to give an alternative, if you will.
I mean, you're doing you have a legitimate medical practice and you're following all the rules. But these places, they give you a menu. I've seen the menu. My buddy looked at it because I was going to start using this place, and they got my cell phone number. They still call me years and years later. Jupiter, Florida, it always says. I'm like, mother, it's these people. It's a sales pitch every time. And it's a menu, and you can get whatever you want. There's no restrictions. If you want to get, 6 bottles of tests to last you a month and 4 bottles of Deca, if you want to run 3 or 4 grams of steroids a month, plus GH, I think they had clenbuterol. I think they had all that stuff too. I'm not sure. It's been a while, but
they do. No, they do.
You can buy it, and no one's. There's a doctor somewhere. A doctor's signing off on all that.
What happens though, Ron? Those places, they don't last, and that poor doctor has like a gun to his head. Some Indian guy, some juiced up.
We've got your family, Patel.
I mean, I'm not kidding. I mean, I'm telling you the truth. It's some washed up doc. I mean, look, I'm politically, I'm just like you. I really don't care. I'm here for the truth, and my business is great because it's all good karma.
Yeah.
So I'm there to help out and clean up, and I'm not putting anyone down. But the truth of the matter is, I mean, if you're going to do that stuff, the guys who run the clinic are these businessmen, genius businessmen, and they're all juiced up and they're all fucked up, and I don't respect them. They got some little goddamn geeky doc in the back with a gun to his head.
Jeez.
I mean, come on, doctor. You're going to do this? Really? You don't see your patients and you're giving clenbuterol, steroids test, young men? I mean, you're a piece of shit.
Now, you say they have a gun to their head, but I mean, it seems to me if they're paying these guys well enough so that they don't even have to practice medicine, all they have to do is sign off on,
They lose their licenses.
They do lose their licenses.
They're not around, man.
Wow.
It's a time clock. It's a time bomb. The guys, sooner or later, DPH comes in and takes and does an investigation, and they just wipe the place out. And the guy that owns it just goes across the street, gets some other pathetic doc, and it just continues the charade. Hey, man, I don't know. I'm just telling you the truth. That's what's happening. It's a lot of money, a lot of stuff, a lot of bucks, man. And I'm not saying that some of the stuff. I mean, well, it's bullshit. Anti-aging is bullshit. You don't want to anti-age, don't have a goddamn heart attack.
Well, that would be anti-death. But
so anabolic steroids and testosterone growth hormone, if that's your quality of life, call it what it is. And then I'm just going to try to clean it up and try to do what I can to help you out and to do what I think is right. And mainly, it's all cleaning up the cardiac problems I see.
Right. And I mean, you're going to have business forever because of these places, because they're creating. Not that you need business. I'm sure you're doing fine. You have plenty of patients that want to see you, but they're creating future patients for you every day, are they not?
Ron, businesses, we're almost booked up solid right now. I made an announcement. I don't have much time left. The trip from Florida is almost booked up solid right now.
Wow.
Yeah.
How's that Dr. O'Connor clone working out? Is it almost fully formed?
Oh, Jesus Christ. I don't even know what I'm going to do because I'm so busy doing my media, seeing my patients. Yeah. I mean, Ron, and I'm keeping the devils away, you know what I mean? But, I got to take care of people up here in Connecticut, and Florida's, growing fast, and we're going to be down there every month. We already got it all booked up pretty much this time, and it's fun. It's great. I do want to reach out to give doctors an alternative to give the patients to me if they're on steroids or testosterone.
Right.
And anti-aging guys, I mean, I'm going to lend out an olive. I almost said an olive tree.
Branch.
I'll lend out an olive tree and a branch, and I'll give it I'll give a whole bunch of a whole basket of olives. I mean, it's like, look, man, haters are going to hate. I just want to give people the open, honest truth of what the science is behind what they're doing. That's all I want to do.
Okay.
All I want to do.
All right, so we'll close that out. I think we covered it. So everybody, all you meatheads, it's not going to be legal. You can't keep hoping and praying and write letters to your senator. It's just not going to happen, guys. Just going to have to keep buying from Joe the Juice Head in your local gym. Anyway, all right, let's move on to some good, legitimate medical questions, shall we?
Let's go.
So this is from Squat Junkie. He said the doctor mentioned cortical. He said cortical. It's actually cortico, right? Corticosteroids?
Yes.
Corticosteroids like prednisone being testosterone wreckers. People with asthma inhale medication like salmeterol, salbutamol, etc. These medicines are also corticosteroids. The only difference is that they're not being ingested but inhaled. Does inhaling these corticosteroids wreak havoc on a man's testosterone levels? Does inhaling them have a negative influence on the middle-aged guy's TRT regimen? If yes, how to tackle this?
I'm going to try to be really tight for my audience. The answer is, when it's given systemically, like prednisone orally or salmeterol IV, or even Medrol tabs and the tablets. Yeah. That goes throughout that distributes throughout your systemic system, right? Your whole body, right?
Yeah.
Because it distributes to your GI tract, and it's if you have poison ivy, so you're giving prednisone taper, and you need that, and it goes throughout your body. And if we do it just minimally, you just gotta hit it fast, get in and out quick. You don't hurt the adrenal gland, and hopefully most people, in most circumstances, they don't have a problem. Now, those are called systemic corticosteroids. So what we've learned is that if you do inhaled steroids for asthma and COPD, which I have a lot of these patients, as a primary care doc I did, that it's minimized. The distribution is and of course it does have a warning saying it could go into the system minimally, but you're inhaling it, so either in the nasal steroids, right, for allergies, seasonal allergic rhinitis, we do Rhinocort and all these different derivatives and a couple of sprays, and it's very good for allergies, right, for the seasonal allergies, right?
Yeah.
So but it's limited. I want to be very, very tight today. It's limited. The distribution is limited. Doesn't get into your system, and if it does, it's not much. No. But people that have asthma and have and even in recent years where they're using more corticosteroids for COPD. I'm not a pulmonary expert, but I'm an internist. Again, it's if you have to use a lot more of it, some of it gets in your system, and so when you're inhaling the steroid, it's delivered to the lungs for the respiratory disease, and hopefully it's just enough to help the lungs so you can breathe and feel good, and not too much getting into your system. Correct?
Yeah. I mean,
so that's a great question.
I mean, if that were the case, wouldn't we see a lot of asthma sufferers, male asthma sufferers with low T?
Yes, and you don't. The inhaled steroid is not enough to affect your endogenous androgen. It's just not. I'm not saying there's not a man out there in the world that's taking tons of it for years and he's very susceptible when he has low T. I'm saying I want to be very discreet on my show these days. The answer is it's a localized minimal dose. It's not systemic, and it's aerosolized, and it covers the bronchioles. It goes in. It gets a little bit in your circulation, but it doesn't lead to hypogonadism. But let me talk about the mechanism of how corticosteroids systemically lowers and affects your testicles and your hypogonadism. Do you know how it works, Ron? How do you think it works?
Boy, corticosteroids.
I have to do this. I
honestly have no idea, Doctor.
Bro, so we always go back to the bro science,
yeah.
And it's real science. And so in your pituitary gland, anterior pituitary, you have luteinizing hormone, follicle stimulating hormone, and you have something called ACTH, which is it's a stimulating hormone for your adrenals. So it's amazing. Your pituitary, your central nervous system, your hypothalamus, the low part of the brain, and then the pituitary runs your thyroid, your adrenals, and your balls.
Oh boy.
So if you shut this down, so this is for everyone who really, the adrenal fatigue and the adrenal medicine and all these, there's supplements for my adrenal. It really is true. It's very, it's Cushing's disease to Addison's. Addison's is lack of, and Cushing's is too much. So it's like, this is the whole, and I don't want to launch off into that, but I will say, so systemically, when you take enough corticosteroids, it definitely has an effect on the adrenals and your pituitary. Now, there's carryover. So you'll be affecting those receptors that are also important and for secreting luteinizing and follicle stimulating hormone, which we know are going to be related directly to stimulate the Leydig and Sertoli cells in the testicles, and that's endogenous testosterone.
Okay.
There's an overlap, and the adrenals are in there. And I'm no expert on this adrenal stuff. I don't like to deal with adrenal stuff. It's complicated and it's arcane to me, and I just don't see people with real adrenal disease. I make sure they have a neuroendocrinologist. And I have some that I use throughout the Northeast, and they're very. I was talking to one today. I have a patient. I have a woman still in the practice. She has Cushing's. She has legitimate Cushing's. I don't deal with that. That's not even a standard endocrinologist. It's a neuroendocrinologist. And so this, but there's an overlap. So the corticosteroids they're very toxic, man. I try never to give prednisone to anyone. I only do prednisone when you have really bad allergy reaction, or you need it systemically for your asthma exacerbation, or a very bad poison ivy. As a primary care doctor, that's how I use it. But so systemically, though, that corticosteroid, if you're on it long enough, guys who have asthma or guys who are using it for all the other reasons, you do see it's one of the reasons for hypogonadism.
Now, at the real risk of sounding like a moron here, do corticosteroids increase your production of cortisol?
No, they just like testosterone will do. They're gonna supplant it. They're gonna shut it down.
Okay.
So cortisol comes out of your adrenal. Cortisol is an amazing drug. It's an amazing hormone, and you need it to live in the world against infections, inflammation. Very complicated. Even rheumatologic disease. Again, I am no expert in rheumatology, but the truth is that when you give too much of if you give prednisone over, that's why we taper it, right?
Yeah.
So prednisone taper, because we don't want to shut down what? Your adrenals. What part of the adrenals? There's actually 3 drugs in the adrenal, three endocrine substances there. Cortisol. So we give you need to have an extra bump. Like, so if you're having hives or you have poison ivy, nothing is better. When you have serious poison ivy, you don't go for the topical. You don't go for the stupid topical. You don't Benadryl. You go for 60 milligram smash taper or pulse of prednisone. I gave out last 2 or 3 months. I've given out I prescribed it 20 times. Poison ivy.
What the hell's everybody running through poison ivy fields?
That's it, man. It's a miracle drug. It's a miracle drug. But after that, they're going to get you're going to potentially deplete their adrenal. That's the adrenal fatigue thing. Again, I try to stay away from that whole stuff because I don't know about it. It's not my line of expertise. But so it's like giving testosterone to a man who has testosterone.
Okay.
So it's like giving an antibiotic to someone who has an immune system that's working, but it needs more help. So it's probably a bad example for the antibiotic, but for cortisol, so you have cortisol, it's not enough, and for whatever reason, so you give more steroid cortisol, which is prednisone, or Solumedrol. In the hospital, we do the stuff IV, and whoa, this is life-saving stuff, man. But again, you're going to have an after effect where you're going to be fatigued. And we try to let people see how they do. Sometimes we have patients that we have to give, for an example, 5 milligrams a day of prednisone for the rest of their life. That's like, so they're on physiologic cortisol. Addison's disease and people that have had rheumatologic disease and have transplants, kidney transplants. Most of them live on a little bit of prednisone every day.
Wow. I didn't know it was something you could be on forever with a...
Yes, and it can hurt the eyes, cause cataracts, it can cause elevated sugar, diabetes, and it can definitely destroy the bones and cause osteoporosis. So that's the opposite of anabolic steroids that can make the bones stronger. Isn't this incredible?
All right, the last question. I don't know if it's from Squat Junkie or Alberto's, so I apologize in advance because I didn't make a little note. From a health point of view, I know it's important not to blast gear all the time. This is why we blast and cruise. But from the point of view of making gains from drugs, is it also wise to take long breaks where lower doses are used? And I apologize, doctor, that you're going to be getting questions from meatheads who just want to get big, and
that's okay.
They're not all going to be questions about how to live longer and healthier.
That's okay.
Some of us only care about the gains. So
I'm the anabolic doc. I have to field these questions.
I mean, you're the only we've only got one other anabolic doc, and he's over in Greece. So
I'm bringing him in. I'm bringing that guy in.
Dr. T. So yeah.
What's the question? What's the question? Okay.
So he knows it's not healthy to blast steroids all the time, large amounts. But so he wouldn't do that. He knows from a point of view of your health, you shouldn't do that. But if someone's trying to maximize the amount of muscle mass they gain over a lifetime or what have you, would it make sense to take breaks where you're using these lower doses, or does it matter? Could somebody just blast a gram or 2 grams a week forever and it'd be the same end result?
I tell you what, this is a great question, and I'm gonna give my side, and then you are gonna tell us what your side is, because you're the real guy in the streets, in the fields. So we all know that you don't just, now apart from health issue, this is not, don't try it at home. Apart from health issues, I know steroids. I know how they work. I see the guys. I've heard of them. Incredible. I've been 30 years. So you don't just stay in the same dose. You taper them up. You taper them down. You cycle it. You stack them, because it's all about receptors, Ron, and it's all about, the guys, they get stagnant, and they need to increase and shake it around, and they need to, just like training, you just don't train the same way all the time. Right. So depending on your receptors and depending on, are you a responder? I talked to a guy today that I'm so happy that years ago I got him off steroids, and he has body dysmorphia. He looks in the mirror and he's down from 270 down to like probably 240. And he's just on TRT. He's got a good family, and he's late 30s. He's really good. He got a good job, and he's a regular guy. And I saw him. I hugged him today. I see him like twice a year. He's not too far away from here, but he's not from Connecticut. And I just caught up with the guy, and he's like, "Doc, I'm doing good, man. I don't need to be that." This guy's huge. I mean, this guy's good looking, hard as, he's a monster. And we were talking about the response. He was mentioning some other guys and some pros that he knows. And he said, "Man, I did the same drugs they did, the trend, the same dose per dose trend, EQ, the test levels, the orals, and this is a big boy." But he's like, I'm looking over at the pros he's training with. He's like, these guys are just freaking responding so much more. Genetics.
Yeah.
So the truth is, you want to get, you're here to be Rami, great. No one's going to be like him. It's a guy's a genetic gift. Yeah. He trains hard. I'm paying the guy his due. He takes steroids. No kidding. Who cares? I care, actually. I don't want him to die. But, he's taking steroids. Who cares as far as like, oh, boy, he's taking steroids. Okay, great. So is he doing, if you're going to take the exact same stack and the same duration, milligram for milligram, rep for rep, calorie for calorie, you're not going to look like Rami.
Right.
So now that's what I have to say, because there's genetics. There's so many multifactorial variables. You want to do, typically more is better. But there's a point where it's actually not true.
Right. So Mike Quinn, Mike Quinn, the bodybuilder, right?
What's that?
Remember Mike Quinn, pro bodybuilder?
Of course, yeah.
Okay. He actually put it in one of the most simple terms. He said, it's kind of like a glass. You fill up a glass, it's only going to get so full, and then everything else you put in that glass is just spilling over and wasted. That's the side effects and the adverse health effects that you're getting beyond the beneficial effects. past a certain dose for you as an individual, which
Well,
is going
what
to
do you think, Ron? But then that's great to say that. But then how about the guys that are? I see guys. I hear stories of guys, and I don't see really these big pros don't come to see me. I don't want to make any. I don't. Those guys don't come to see me. The average guy comes to see me who's on steroids. That's my life, and I love that. But Ron, let's call it what it is. Guys are taking 10 grams a week now.
Wow. Yeah, you're right, and that's.
Don't tell me. Am I right or wrong? Am I bullshitting?
There are not many who are using that from what I hear, what I know, but the fact that anybody's doing that for any sustained amount of time.
Grams? How about 5 grams? 3 to 5
Okay,
grams.
3 to 5 is average for a top level big guy. Let's say anybody in the 220 to 280 pound range. I don't think too many of them are using less than 3 grams a week. Probably 5 grams a week is average. I think they tend to use more during contest prep, obviously. The doses are higher for prep because they're trying to preserve all the muscle tissue while they're on low carbs and doing more cardio. But even in the off season, yeah, 3 to 5 grams is nothing special anymore. And these are responders. These are people with great genetics that you'd see them walking down the street and your jaw would drop. Like, is that a human being? It looks like something just stepped out of a, CGI out of a Marvel Avengers movie or something.
I mean, so it just and this is such a huge part of our community now that you can't turn a blind eye to it, and it's amazing just doing these talks, Ron, because it's that guy wants to do. Okay, doc, blasting and cruising. Well, it's typically more you do to a certain point, you get bigger and stronger. But there's so many genetics. There's different types of drugs, for the hardening drugs and the bulking drugs, the cutting drugs, right? I mean, you guys know more of that than me. I don't know. We don't know how to. I'm not a guru.
But get back to the receptors, because that's a bro science term for sure. I know it's an actual thing, but we talk as bodybuilders talk amongst each other that there's a need to go lighter on the doses, or off completely if you're still at that earlier point in your gear career where you can come back from and have some sort of production where later on you're not going to have that. But we know that we talk about the fact that taking these periods of time where we cruise and use lower doses, that's supposed to recharge or regenerate our receptors and allow them to be more receptive to the drugs once we kick in the higher doses again. But is that a real phenomenon, or is that all just something that we made up?
Well, Michael Scally is really one of the experts on this, from 20 years ago. I mean, he's like, again, I guess the grandfather of anabolic doc, if you will. But it's like, and he lost his medical license and he's living in Europe now. So, but no one knows. Ron, this is doctors. I'm trying to get some traction with some real academic guys on this stuff, at least to heal people and to do some kind of registry and to try to bring men together to come out and see if we can do PCT and does it really work for these guys? That's number one, right?
Yeah.
Can we recover someone? We're doctors. We're supposed to heal. We can't give things that hurt. If they hurt, we can't give them. So sorry, but we're not going to hate on you. That's my mission. But we could heal you. So coming off steroids, cycling on and off, it is true. Guys go on. They get to a point where they feel diminished return. They feel that they're losing their gains despite using the same or more drug. So they shake it up and they start using. I told you, Benadryl, antihistamines, Pepsid, antihistamine 1, type 1, type 2 antihistamines. There's all sorts of more. I don't get too much into this stuff anymore. I knew a lot more back 10 years ago, and I don't know if it's changed. There's no data. It's all bro science, which is very cool. I think it's very interesting. And men just learn how to cycle up, hit a peak, come off, do this drug, step down this drug, hit that drug, step down, and then you reset. It's all the androgen receptor in skeletal muscle, forget the heart for a minute, and how it gets turned on to translate to produce more protein, actin, myosin, so that you get hypertrophy, maybe hyperplasia, if you're talking about hard training and other growth factors and IGF, and it's incredible science for what it is. So they're hitting it more. It goes up, 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 up. There will be a point where it hits a top, shift, change, get another receptor, hit that receptor from another angle, another anabolic, hit it with other growth factors, insulins, antihistamines, cycle it down, cycle it down, cycle it up. Every time you come up, you build more. That's what they do. That's it. So that's the answer.
So there's no data, there's no studies. It's all
None.
Everything that we know about this, as far as where we make better gains or worse gains from, and how we use the drugs and how we taper them down and bolster them back up again. It's all handed down anecdotally. Well, now we have the internet to do that with, but there's no medical
anecdotal.
There's no actual
scientific
or medical knowledge.
There is some. I don't want to be like remiss. I mean, if you look, there's going to be some small, and I don't want to put those physicians or those medical grad students wherever they are, not in this country maybe, but other countries, and there are some small case studies and where they've done some biopsies, and forget the mammals, juicing up dogs and stuff. Yeah. I don't. Again, I love dogs. I mean, just don't juice up the dog and biopsy. Cut its leg off. See how
that poodle of yours looks pretty good, though. I don't know. It's a little suspicious, Doc.
I mean, so what's that? What's the big? I should know this. The big the cow. That has the
Belgian blue.
Yeah, I mean, that's just like this genetic myostatin inhibitors.
Right.
I mean, so it's like, men, this is all handed down. This is all bro science. It's all anecdotal. There are some clinical trials. There's no one doing massive trials on it. But we should do something because, again, I'm going to be old and frail, and I don't want to, if I fall on the ground in my kitchen, I want to be able to get up.
Well, I mean, getting back to what we were talking about with steroids ever being legal and why they can't be, you couldn't do a study like this. It's unethical, am I right?
I keep hearing that, but Dr. Bachands did a study where he gave guys up to 800 milligrams a week at Harvard, the big H, and he found out that the more steroids, more testosterone they gave, from 200 to 800 milligrams a week, I believe, of cypionate or nanthate or something, and their leg extension power got better the more steroids he gave them.
Okay, I mean
he did it.
That's a start.
I mean, so Dr. Bachands kind of like, he's kind of like the anabolic doc out there too. Yeah. Although the guy's a great guy, brilliant guy. He's out there fighting the fight. He's written the articles. He says you can't let these men suffer. You need to take care of them and give them compassion and wean them. You can't just say he agrees. Post-cycle therapy. His studies. He talks about with Pope and Kaniyama. It's all in my book. I wrote about it. I've documented all this from other physicians, and this is the beginning of our society of being humane. And these are men that are going to be suffering potentially. You can't turn a blind eye to them anymore.
Now, I know you call yourself the career killer because you've talked a lot of heavy steroid users out of using heavy doses of steroids. You've weaned them down and you've gotten them on TRT. I'm just curious, roughly, what is your success rate with these conversions, if you will, Ben, with these guys? I mean, how many guys come to you and you say, this is what's you're at risk of developing, this is what could very well happen if you keep doing what you're doing, and they say, yeah, but you know what? I'm going to keep doing it anyway. I mean,
let me tell you what it is. Near 100%. You know why? Because the big guys, none of the pros come to me. None of them come. None.
Just out of fear that they know what you're going to tell them.
They don't come. No. Who comes? The guy that buys the magazine, the average guy that I see myself as the average guy. So the average guy that's on steroids, it's like, I just don't know if this is a good thing for me anymore. So, but now my tea is messed up and I don't feel well and I want to see Dr. O'Connor. That's my bread and butter. So guys that come to me, I have a very, and also you got to remember, it's the good old-fashioned American dollar. Guys come and pay me, they pay me money. They're not coming in, they want help.
Right.
Things are great, man. I mean, I love what I do and there's no changes. I don't need to change anything. It's just going to be, like you said, reproducing what I do because we're very busy, but it's all good karma and ethics. Men, those pro bodybuilders, they came 10 years ago to me, and I think they respected me. Some of them call for they do hour consults and they ask certain questions, mainly fertility, and of course, unfortunately, when they have a heart attack or they have kidney disease, they come to me. So, and then their career's over anyway. But even some of them keep going until they're just completely. Look, it's not an easy world, buddy. It's not an easy world. But the average bear that comes to me, is a 35-year-old man on steroids for 10 years. He's a regular guy in America, loves taking steroids, but now he's like, the wife's there kind of like, hey, buddy, I'm not giving you these shots in your ass anymore. But they do. The wife loves it. It's his wife. Yeah. There's no rocket science. It's like, look, buddy, you've been on steroids for 10 years. You're 37, maybe 40-something. We got a couple kids, and come on, man. Go see O'Connor.
Okay, fair enough. I'm just curious.
Those are my guys, man. Those are my guys. Those big pro guys.
Yeah.
Good luck. Good luck.
Well, they'll probably see you when they retire. Some of them have called. I will never say your names mentioned, but they're just so arrogant and just so bombastic. Oh my goodness.
Oh my God! It's just like, and they think, what do I pay you for? You're the anabolic doc. You're gonna give this some kind of a elixir that's gonna protect all this.
Yeah.
That's insane.
I get that. I totally get that point of that mind frame, because, they would, if I was in their position and I knew I had to use these drugs to do the job that I had chosen for myself and that I was good at, I would not want to hear anything except, okay, keep doing what you're doing, and I'm going to prescribe you this, and everything's going to be A-okay. You're just going to have to take a couple pills a day, and that's going to protect you from all harm, and go forth in peace, my son.
Go to the anti-aging guys in Vegas and Florida. Good luck.
Yeah, Vegas.
I don't do that. I just don't ever. I never have. I never will. I guess I lose a lot of business, and that's okay.
Yeah, if you lose a little business, you'll keep your medical license, you'll keep your practice, and you'll keep your integrity and your reputation. So,
guys coming on steroids. I talked to a guy a few hours ago. I show them. I answered his questions. He left. He shook my hand, and he's, thank you so much, doc. And I could see his eyes going. I could see his brain going. He's thinking about stuff. Yeah.
Anyway, that's all you can do.
That's all you do, man. You lead the horse to the water and provide it with some water to drink. You see if it drinks.
I was thinking a couple weeks back. I was at Six Flags New England. Took a wrong turn out of the parking lot, and I think I was in Connecticut. I said, I think I'm probably pretty close to Hartford.
You were. You gotta come down, man.
That place is way the hell out there, Six Flags.
Oh, I know.
All right, cool.
Crazy place.
Okay, well, that'll wrap it up for this one, Doc. Appreciate it very much. Get some good answer to that first question. That's one that we really need to discuss. I'm glad we got that one covered today. So everybody, check out the doctor's websites: anabolicdoc.com, metabolicdoc.com. Those have links to his YouTube channel, which he's been dropping some really great videos lately, very informative. They go far more in depth than we can here, because on these videos you got me yapping. So,
but please watch for tonight. I believe my my video guy, my web guy, is going to have up. Well, he's coming back from Burning Man. You know what that is? Burning Man.
I've always wanted to go.
Yeah, so he's coming back from that. So I love this guy, and he's just like, I say, buddy, you just chill out, man. If you can get it up, if you could get it on, upload it tonight, that's cool. But I shot a video that's huge. It was my dream video. It's called equipoise. It's called decadurable and equipoise do increase red blood cells, but is it dangerous?
Oh, okay.
And I went through a really complicated background with basic medical support and data for erythropoiesis and polycythemia, defining the terms about the numbers and levels, all the mechanisms, even back to paleontology. And then I talked about I talked about the 1, 2, 3. What do you do? What do you look for? How you're monitored? I give it all away. Everything's for free. I do it all, and it's how I manage it. I give it all out there. This one, though, I want this one. This is big. And I put the DECA and the equipoise in. It's mainly just if I just put polycythemia on testosterone, do you realize that no one watches it?
Correct.
Ron, I am so, this world, my YouTube is blowing up. We're getting like 30 to 50, some days 100 subs a day. And that's great, obviously, but it's because of the SARMs video is blowing up. It's like just keep hitting the refresh button, and it goes up by like 100 views every like 20 seconds.
Wow.
So it's because of the word SARMs. It's kind of clickbait. But when those guys, when they come in though, and they subscribe, they do watch the blood pressure video, and I hope it helps.
Yeah, you hook them in with that, and then hopefully they stick around and watch all the stuff that's going to help them live longer too.
But I love the social media, man. Thank you guys, all my supporters. I am so happy. I'm not that happy because it seems like you're happy you're going to get taken down. But it's just like things are good. We're moving fast. You know, even thinking about putting out another book, and we'll come out with that sooner or later. And we're just here at the Anabolic Doc, Metabolic Doc, and taking care of men only, men that want to be protected against heart disease, men on TRT, men on steroids.
Well,
that's it.
On behalf of all the men of the world, Doc, we thank you. Thank you very much. Appreciate it. All the juice heads of the world, we give you extra thanks. You're the best.
I do love them.
All right, so everybody, thanks for watching Ask the Anabolic Doc. We'll be back next time. Thanks for watching.